Friends, this is Dr. Ravi Kamapalli. I'm bringing an interesting case of a patient with a diabetic foot ulcer with a high touch metabolic health improvement approach using infectious disease wound care along with food logging and the continuous glucose monitoring and ketone breath analysis technology, but along with that, a patient engagement approach. I'm an infectious disease, wound care, and obesity medicine certified physician practicing in Georgia. And my website is nobadbugs.com. And my Twitter handle is at wound physicians. This is a nice 56-year-old female who is suffering with significant problems with diabetes and diagnosed in 2008. She had at one point gone up to weight of around 270 pounds, did keto diet, and regained the weight back. Ended up presenting to the podiatrist after she had some left foot problem and ended up having skin graft done, finally ending up with fifth metatarsal ulcer after she had an amputation of the metatarsal done, and that amputated area did show osteomyelitis and wound did not heal despite skin substitute application done. She was referred for infectious disease evaluation, and essentially during the evaluation process, we started her on IV antibiotic therapy with ceftriaxone, and also found that she has had some fatty liver. Did a fibroscan testing that did not show much of scarring, but did show some fatty liver still present. We re-engaged her with her dietary lifestyle and helped her with her improvement of her health. And also, we did discuss with her about her risks of hypoglycemia. And she did, along with her uh, uh, initial clinical presentation, also have sudden retinal bleed in the left eye. And that was referred to the eye doctor. And also, we did a unique approach, and I will explain that to you. And at her initial presentation, her waist circumference was 45 inches, and uh, around the Ross visit on October 11, 2022, her waist circumference has come down to 39 inches, and has her weight has come down from 221 to 203 pounds. And obviously, we did body composition testing also, and I'll explain that to you. This is her initial presentation, and basically, she ended up continuing with local care per podiatry service, and started. We can see here, this goes on to heal quickly with continued wound care and antibiotic therapy. Here, this is a complex wound, but the problem is metabolic health presentation also. And what was the approach we did was we did give her continuous glucose monitoring with CGM device. Here we use Dexcom, and also there was a breath analyzer, that ketone breath analyzer that we gave her, and we were able to monitor her and also literally help her get her off her medication. And we continue to monitor and using the continuous glucose monitoring and slowly making sure that she does not go into higher ketone levels. More than 40 is worrisome, but she was in the ranges of 13 at some points, but ended up she came off her medication, and her blood sugars were in the range. And here we have an interview with her, and after that I will give you the more evidence on this. Hi, Christina. Hi. Everybody, thank you for coming. Thank you. So, Christina, tell me what made you come in today.
Well, I had a foot ulcer caused by diabetes. Not staying on my diet. Blood sugars were way out of control. And I had stepped on something, had a small wound on my foot that just would never heal. And ended up going to see another physician in LaGrange for that, and found out that I had a bone infection. So then I had to become susceptible to this sepsis issue, and I had to be put on a PICC line and antibiotics.
How do you think your infection happened? I mean, did diabetes contribute to this problem?
Oh, sure it did, because my blood sugars were way high. There's no way that wound was going to heal with my sugars being that high.
You were on sugar medication?
Yes, I was on.
What were you on?
I was on Trulicity. They had already gone from 3.0 dosage to 4.5.
Okay.
I was on insulin.
Wow.
I had 50 units in the morning and 20 in the evening.
Oh, okay.
So I was on some pretty heavy
Farxiga too.
Yes, Farxiga.
So this you were. What was your feeling when you were going through all this? Were you going to lose your limb, your life, or?
I was really concerned, because when they start talking to you in terms of, if you don't do something about your diabetes, you might not be around to see your grandson graduate. It kind of hits home,
yeah.
Because diabetes is something you don't really know that you feel bad until you start feeling good.
It's a silent killer.
Yes, it is.
It is like the plague, the new plague that is hitting the affluent countries and even the non-affluent countries. So tell me about your weight journey. What did you think you had this weight issue for a long time?
Oh yes, I come from a large family of overweight people. My mother, when she passed away, was 340 or so.
Wow.
She was a large lady. But we've always eaten, our upcoming was country folk. You gathered around the kitchen table and you visited. You didn't go sit in a living room.
Okay.
And you ate biscuits and you had coffee and,
a good time.
Yeah, when you visited, you ate. And that's the way I was raised.
Yeah.
So, and even when you watched TV or entertained outside, you always had food. At your fingertips, everywhere. So, and I guess I don't know if that's just Southern culture, but that's just the way I was raised.
It is over culture now, over eating, because we are driven by our monkey minds, and we listen to it, and there is so much abundant food around, and we end up becoming a fat-storing people rather than the fat-burning people. So, tell me about your weight loss journey that you tried.
Okay.
What was your highest weight?
My highest weight was about 280.
280.
And I didn't see a physician, didn't do anything other than I was eating basically one meal a day, parked at the end of Walmart parking lot and walked to the store instead of trying to find a closed space. Just anything I could do to get a little extra exercise, because I did have rheumatoid, psoriatic, and inflammatory arthritis.
So they diagnosed it for you? Okay.
Yeah, so I was never on any medication for any of that, because back in the 80s I had hepatitis B and had a bad liver, so they didn't like to put me on any extreme medications.
Okay.
So I never took anything stronger than Tylenol for that. But, I've been heavy most of my adult life.
And then they diagnosed you with fatty liver too.
Yes. Yeah. And so because of all of that, and being around my parents that had heart disease and stroke issues because of their weight, and then, being diagnosed with diabetes and being told, that you have a short lifespan because of that is a little scary.
You did try some diet and lifestyle. What was that?
I have been on physician's weight loss.
Physician's weight loss.
I've been on Jenny Craig.
Wow.
Diet Centers of America. Weight Watchers multiple times.
Wow, you gave them your due, huh?
Yes, so I've been on several different programs, and that stuff is all great and fine. You lose weight on it, but I had no lifestyle change when I came to my goal.
Okay.
So when you go back to eating regular food,
you're back to square one.
You're back to square one. When you have a metabolism like mine that was slow, you just gain the weight back.
So there is no such thing as a slow metabolism, because we are living and we are sitting here. Our metabolism is at the basic range, but then how we stimulate the hormones. See, humans are metabolically modified beings. The genes have not changed in millions of years. The genes are the same. It is our food that is modifying our genetic expression through the hormonal impact of the food that we eat. That's what we are trying to change here. Now, let me ask you about your job, and you work in a healthcare field.
Yes, but I have a pretty sedentary job. I sit at a computer all day. So,
but you have seen the diagnosis
yes,
of all these.
I have worked in the dialysis clinic. I've worked in hospice, and I've worked in skilled nursing.
Okay.
So I am,
You see what people go through, and you are seeing the impetus of what is going to happen to you if you went through it, and you are trying hard. And what happened when you came to me? So you had to go through all the trouble just to come and see me, I guess.
Yep. That's what my grandmother used to say. You have to go through the storm to see the rainbow.
So what is the rainbow all about now? Tell me.
Well, living healthier. I feel better. I have more energy. My husband can't believe the difference in my energy level.
Yeah.
But I get up in the mornings at 5:30, jump on the elliptical or the treadmill, walk for 30 minutes before I start work, and it just kind of jump starts my day, gets me in a good mood. And of course, like I said, eating healthier, you don't feel weighted.
Yeah.
All those carbs just make your body feel like yuck.
So carbs are crap, you say, huh?
Yeah. So
for you.
I haven't gotten off my diet. I haven't tried bread, pasta, anything.
Do you get tempted when you see those like before?
Sometimes.
Okay.
Sometimes because I was a long-term carboholic. Love sweets, especially things that are homemade.
Yeah.
So
you try to avoid So you have have you engineered your environment? Have you changed your environment at home?
We don't even shop at grocery stores much for anything. We buy buttermilk, eggs. But for the most part, we go to the butcher shop and get our meat. We go to farmer's market and buy our fresh vegetables.
Okay.
And that's how we cook.
And then basically, tell me what steps have you taken in this journey since you started seeing me?
I have to say that I'm doing the bad thing as a grandmother. I still buy sweets for my grandson. But for the most part, we don't stick to buying any kind of bread, pasta, rice, potatoes, anything like that. My husband's even adapted his lifestyle to mine, so that there's no temptation there.
So it's not just one person approach, because everybody is in this together. In fact, as a family, it has to be a family approach to this. There is no other way, because temptations happen, and we kind of are loving, but sometimes the love can kill too. So the question just comes down to, tell me the exact steps that you followed that empowered you to be sticking to this lifestyle.
Well, for the most part, it would be to watch my weight, and I have to say that I was doing the wrong thing. I was weighing every day. So when I weighed every day and I didn't see any weight loss every day, I would get discouraged. And that would sometimes tempt me. So I stopped doing that. I do not weigh every day anymore. I stay busy.
Okay.
I clean my house. It's immaculate right now. I clean my house a lot. Stay busy. Keep my mind off the food. We prepare meals together, so that I'm not in the kitchen by myself taste testing everything, So we prepare our meals together. We go grocery shopping together. So it's been like you said,
I'm talking about
effort.
the medical side of it.
Now the medical side, I have a blood pressure machine. I have my Dexcom that I monitor my sugar on daily, and I keep track on that. But I haven't had any complications where I had to see since I come off of the medications.
So I'm talking about the food tracking, the app.
Yes, I do the food tracking. I have Fruit Health that I take pictures of my food and my glucose meter and my BioSense that measures my ketones.
Yeah.
That keeps me on track, because if my ketones are too low, I know I'm not burning fat. So I keep check on that daily. And then when you come to the visit, so you're getting the feedback of whatever you're posting, because so it's like a policeman sitting behind you telling you which way or another. We give you a feedback,
and we do that body composition testing,
Right.
and then we guide you. So the foot is all healed. Now, what are your next goals?
Well, my next goal is I want to increase my activity.
Okay.
Because I don't like sitting and doing nothing. I like to stay busy. So I'm trying. I'm going to talk to my husband about is trying to take some hiking trips or something like that because I think that would be a healthy.
Be careful
activity.
with your feet when you do that. And then also the question is you need to increase your muscle mass,
Right.
and then also work on really targeting your fat mass. Has your wardrobe changed?
Oh yes, yes.
Is it
I've gone from a size 22 to about a 16.
Okay.
Even though I haven't had a huge weight loss, I have seen a big difference in my
I mean,
weight.
remember you were stuck in your weight. You lost around 18 pounds. And the waist circumference, because most of the fat that accumulates really when it starts to cause trouble, it is a subcutaneous fat first, then gut fat, then the liver fat. Remember, you have fatty liver.
Right.
So the idea is the fat that goes away starts going away from the liver, then the gut, and then the subcutaneous fat. The jiggly thing is not the real problem.
Right.
The problem is inside. So I'm amazed by this. Can you opine as to what you think happened to your wife and how do you think about this whole journey that you're going through?
Yeah, she's gone through for lack of a better word, a metamorphosis. Her whole lifestyle has changed.
Okay.
Her diet has changed. Her outlook of the day has changed. Like she said, she's exercising in the morning before she starts work. She's exercising at night after work.
Mm-hmm.
She's averaging anywhere from, I'd say, 2 to 5 miles a day between walking up and down the road and walking on the treadmill, doing the elliptical.
Yeah.
She has stuck to her diet this time. And like she said, I have adapted my lifestyle to meet hers. And I feel better, to be honest with you. I feel better because she feels better. And I'm getting more physically fit.
Yeah, it's a family change. And thank you for taking time, and thank you for the interview.
Yes.
And then basically it's one person at a time, but then the family next, then the community next. That's what we're targeting. We're going to help the people of this land and also the world.
Yep.
Thank you very much.
Thank you.
So basically, as you can see here, she did lose her waist circumference. It's improved. And her body composition testing after her foot healed, initially her weight was 221 pounds. But when the foot healed, that's only when we do the body composition. And we test for lean body mass, skeletal muscle mass. And basically over time, we expect more fat loss with stable basal metabolic rate if she continues to follow that journey. Her hemoglobin A1C was 7.8 initially, but it has to be 3-4 months before we repeat it. So we are waiting for seeing significant improvement once she comes back for follow-up. And she lost around 17 pounds here. We check on the excess body fat mass. When we initially did this, she has excess body fat mass of around 69 pounds. Her total body fat mass is around 100, and most of the fat mass is around 20. And basically, what we're trying to figure out is in this in this approach, how and what is the evidence in doing this is for us to understand that why are we doing continuous glucose monitoring is to show that if we have the glucose in the time in range, so it improves the cardiac outcomes. So this was a study that was published in Diabetes Care in 2021 of 6,225 adults that showed that if there was time in range, it was associated with increased cardiovascular mortality. But another significant study is comparing Mediterranean diet to postprandial targeting personalized diet. So where they put in continuous glucose monitoring on 225 people, and they used they used PPT, that is personalized postprandial targeting. So that is, they gave them food, but then the CGM wise they were able to measure and change the food according to their glycemic response. So that showed that when compared to Mediterranean diet, the personalized postprandial targeting diet is important. So that improved glycemic control significantly better than Mediterranean diet. So what the whole idea is, we can talk about all the diets, but personalizing a dietary solution is more important. In healthcare delivery, we need to have holistic approach, and that applies to wound care also. In the treatment of acutely infected wound, all risks of infection need to be reevaluated to ensure that optimized healing and guided systemic antibiotic therapy if needed, and local active wound care, and also removal of the devitalized tissue, looking at the microenvironment, moist healing environment, and also chronically infected wound, so that they are advanced strategies. But also, we have to understand that once we are able to develop a solution that is physician directed with a protocol driven, health coach driven, app based solution with that is patient centric, that empowers the patient, that is, the smart goals have to be determined with a coaching angle that need to be deployed using high touch solution that is that is specific for what patient exactly wants. But we have to make sure that there is measurable goals. There has to be an action to achieve that goals, and those goals have to be realistic and reasonable. And also, there has to be a starting point and an assessment point. And the core aspect is metabolic health improvement of the population we serve, and help in chronic disease outcomes for infections, wounds, and also addressing the metabolic ill health that is at the root of this problem. And thank you for listening to this case. And we hope to help and propagate this kind of solution across the community and in USA and across the world. Thank you very much for listening to this presentation.